are going to move into the room. We're going to start by washing our hands. Hello, Ms. Jenkins. My name is Zach Bolin, and I am your student nurse at Southeast. Can you give me your name and date of birth? So she says, my name is Miss Jenkins, and I was born 1/7/47. Okay, Miss Jenkins, so I am going to, or can you tell me what your pain scale is on a scale of 1, or from 0 to 10, 0 being the worst, or no pain, and then 10 being the worst pain that you've ever had. Can you tell me what that is? And she said a 5. Okay. And are you feeling comfortable today? She said she is, relatively, compared to since she just had her hip surgery. And I tell her that today I'm here so that I'm going to be administering you warfarin, also known as Coumadin. It is an anticoagulant, and what it's going to do is it blocks the synthesis of vitamin K so that your blood does not clot as well. And the reason that we're going to be doing this today is because since you just had your hip surgery, you are bedridden, which makes you more prone for blood clots. And then that combined with your history of AFib, which is just an irregular heart rhythm, and then your high blood pressure, as well as your diagnosis of type 2 diabetes. So this all combined is why we are have you on warfarin or Coumadin. Do you know if you have any previous allergies or adverse effects to warfarin? She says she does not, as far as she knows. And I ask her, and then so now I am going to let her know of any special considerations. So we want vitamin K, you need to take it in consistent levels, because if you take too much or too little bit at one time, or specifically too much, it can mess with the effectiveness of the drug. It's not going to be absorbed as well. And so if you, for example, if you eat a lot of leafy greens for dinner one night, an example of that would be spinach, it may cause your warfarin to not be as effective for you and not inhibit your blood from clotting as well. Okay, so do you have any questions for me? And she does not. So we went through her allergies. We asked her if she's comfortable. If she has any preference. Do you have any preferences in how she takes her drug? She does not. She is comfortable. So we're going to raise her to about a 90-degree level, and we are going to go through our first med check. Okay, so we are going to take the drug container out of the dispenser. Okay, and we're going to look at the label. It says, or we're going to compare this with the order, and the label on here says 2.5 milligrams, and then it's warfarin. You want to take it orally, and and then the order says 2.5 milligrams, and then the order says warfarin Coumadin 2.5 milligrams by mouth daily, and that matches with the label. So we're going to take the med from out of the container. We're going to place it into the med cup, and at this point we're going to do our second check. So we're going to check the label again, and it says warfarin 2.5 milligrams PO daily, and then the order also says warfarin Coumadin 2.5 milligrams by mouth daily. So they both match up. And then I'm going to do my third and final med check after I take the drug from out of the wrapper, and then place it into the cup just outside of the wrapper. All right, so warfarin 2.5 milligrams PO daily, and then the order says warfarin 2.5 milligrams by mouth daily. Okay, so since those check up, we have the cup of water right here. We're going to now give the med to Miss Jenkins here, and she's at the 90-degree angle. She already expressed all of her preferences. She didn't have any, no allergies, and she is comfortable. So here you go. And then while she takes her med, we're going to assess for any difficulty swallowing, and we're going to give her water in case she needs it. She did take a few drinks, and then we're going to make sure that she did take the whole pill, and she did. She opened her mouth, it's all gone. And so now I'm going to document that I gave her 2.5 milligrams of warfarin orally at 1800, and then I'm going to sign my initials as well. So now we are going to leave. We're going to make sure she's all right. She's feeling okay. She got it all down, and then we're going to leave. We're going to come back in about 30 minutes. We're going to ask her if she's feeling any different. She feels comfortable. She is. Now we're going to assess for vital signs, and then same for any allergic reactions, whatnot, and adverse reactions as well. My name is Zach Bolin, and this is my med admin video.